So to start the meeting, I just want to make sure we're all on the same page. We're here to discuss how we're going to change our business operations in light of the COVID-19 pandemic. Everyone is encouraged to give their views and suggestions on how we should move forward. So it's no question that the pandemic has impacted a lot, our hospital included. As a level 1 general hospital in a strategic location, we are meant to serve as a step-down care facility for suspected COVID patients. What's important now is to have strong communication with higher level hospitals to transfer confirmed cases for intensive care. Our current capacity is 150 beds, and patients are coming from all areas of Quezon City and nearby cities and municipalities. The impact of COVID-19 is piled on top of other factors. We still have to work our way around our financial slumps and take into consideration changes in our environment, like the local health sanitation ordinance, the push for UHC, the new competition coming in, and the construction of new condominiums and the MRT station. It's safe to say that more patients will likely be coming through our doors even after the pandemic. So do you have anything you want to share, any insights?
So everyone knows that the pandemic right now is hard for everyone. So we really owe it to our customers to lower our prices as much as possible. I also think it's best that we extend our services to patients who cannot afford treatment because of the pandemic has affected their livelihood. The extended period of lockdown has killed so many jobs, all right? Remember, we're battling a pandemic. The fact is, people don't have the money to get themselves treated. We have a duty to step in to make sure nobody gets left behind in that field. We are a health facility first before we are a business. In the long run, people remember how we prioritize their health before revenue, and that will set us apart from the competition.
Okay, lowering prices may be a good way to compete, but will they financially survive? Because again, we're already in a slump since it's October, and this whole COVID thing really doesn't make anything easier.
There are different ways where we can cut costs. We can implement a rotational system for employees to lessen the cost per month. For example, batch 1 will work for this month, and batch 2 with a different set of employees will work next month.
That's actually not a bad idea. I think lots of companies do rotational shifts now to save costs. If 1 month is too long, we can just adjust based on it. It will also help us mitigate the spread of COVID. So if one person gets COVID, rotation still allows us to be operational by hiring the employees from the other set that don't come in contact with patients. I also like the idea of extending our help to those who can't afford treatment. It's like we can let them know that we're taking extra steps to make healthcare more accessible to them during these times, which will build our character as a caring familial institution. No amount of marketing can do a better job than that.
Yeah, I don't know. For me, parang you say it like it's easier said than done, and you kind of assume that the returns are a sure thing. Like if we choose to do like rotational shifts, for example, it's gonna take a lot of planning, and we have to consider a lot of things, like how many people should work per cycle, how long is each rotational cycle even going to be. We have to consider also like, is it going to be weekly? Is it going to be monthly? Who do we prioritize? What do we do if like an employee demands for more work because he or she needs more money? What will we be laying, like how will we lay out our system? And before we get around to finishing the schedule, like we'll be moving to a completely different environment given how variable the pandemic is unfolding. I don't know, for me, because of the system we have now works, like it's tried and tested, and why should we mess with that pa? Like I get naman that you want to help, and of course like we want to be able to provide healthcare for everyone, but we're already looking at a huge loss. Like we're still dealing with our own financial slumps, and some of our facilities have been closed to accommodate suspected COVID cases. Regular checkups don't happen as much because people are afraid to go outside. So if we implement the system that we're unsure of while the landscape is still uncertain, we can go bankrupt. And at the end of the day, we're still running a business. Like if we shut down because we're losing too much revenue, that means we can't provide healthcare for anyone. So I think that's worse than providing services for some.
Okay, so with that said, hear me out first. This may be a hard pill to swallow, but an alternative that I can think of is downsizing our current non-essential employees. We have to face the facts. Our top priority right now is facing the current pandemic, and our profitability has always been seasonal. As such, I agree with Liza that we have to remain our financial stability right now. Even if it's just for the meantime, we have to think of the services that aren't really essential right now. For example, our canteen staff, we're not allowed to eat in common areas anyway, so maybe we could come up with a different arrangement for our employees in that department.
It doesn't sit well with me that we will be driving people to unemployment in the middle of a crisis.
Again, this is only temporary, or would you rather end up just shutting down permanently, leaving our staff with nothing to come back to when all of this is over? So how about this? While our canteen is closed, we can still avail of their services, but they wouldn't have to report to work anymore. Maybe they can just cook food for the entire day in the morning, so we don't have to pay them for the entire day. We need to cut back on our costs, and this is one way that we can do it.
That actually really makes sense. If we think long term, if we can cut costs now and survive the pandemic, then they can go back to work with full pay when things are normal again, or at least when the situation is better, rather than just close down.
Yeah, so I guess we can take note of that idea. Aside from the canteen, we need to identify more departments that can be laid off temporarily or given alternative work arrangements. We can put that in the back burner for now. So do you have any other suggestions?
Yeah, I have another suggestion. So if we really aim to provide our services to as many people as possible, while maintaining our competitiveness given our current market climate, then we have to reevaluate our supply chains. We need to look for cheaper alternatives to our supplies while maintaining their quality. This way we can offer them at a lower price, but it won't necessarily hurt us as much financially, since we will acquire the supplies at lower value. Again, looking at the bigger picture, the location of our hospital is the perfect spot to establish a testing center for those who will be traveling outside of Manila. We can set up a drive-through station where people can get their tests done, and that way we can have an extra stream of income that is aligned with the current situation that we have.
We've already been, excuse me for that, we're already known in the area. This is proven by the fact that we've been providing healthcare for 40 years. Maybe we can couple your guys' plans with a focusing strategy as well, so that the already established BMC is the go-to hospital for family healthcare. We basically maintain a relationship with our clients. The loyal following, we certain referrals, and I know our patients love us because they have been with us for all these years. So we have to do really everything that's what's the best for them, and everything else will follow.
I think that will be really good for business, as evidenced by the last 40 years. Like, our relationship with our patients is a good thing to prioritize, and we really need to communicate that we have their best interests at heart. So if we do this successfully, patients will trust us and they'll feel safe to come to our hospital despite the pandemic. So good idea, guys.
Yeah, okay. But how do you guys exactly plan to do your best and maintain a familiar relationship with their clients? I don't know, for me, because I'm just worried that some people might find it unnecessary or uncomfortable. Like, is that really our priority right now?
I think we can do our best to simple stuff like greeting patients or smiling, even if you're wearing a mask, asking them if they need help, even if we're socially distanced, and following the proper health protocols, like ensuring that everyone is wearing the proper PPEs, providing alcohol dispensers, etc. I also think that the familial support and in general, just creating a supportive atmosphere is something that we all need now during this crisis.
Okay, well, that seems like something we could do. How about Richard's suggestion on being a testing facility? Does everyone agree with that?
I don't know. Can we really afford like putting our employees at risk? Is it worth it?
Being in the medical field has been and always will be a risk because we're always exposed to these illnesses. Once we have the safety protocols in place, things can function and operate smoothly.
What do you think, Richard?
Since we're already on the topic of trying out new things, I have a couple of suggestions to add to that.
Okay, go ahead.
Let me just throw this out there. I was thinking of maybe we could buy out the small hospitals in the area that's going out of business right now to get a hold of their market shares.
I don't know. Do we have the money for that? I don't think we have the money for that.
We can first consult with finance if it's possible or not. But if we really can't pursue this on our own, then maybe we could ask for loans or from the bank.
Guys, we're in the middle of a pandemic. If we can't get the return on investment immediately, it's not gonna fly. Plus, we might have to spread out employees if we push for this, and some might be against that.
You can always ask for a list for those who want to work in the other branch if ever. We can also provide them with a small incentive, an increase in their benefits to motivate them to move. The profits we'll earn from this expansion will probably cover the money we use for the incentive anyway.
Yeah, isn't that the problem? Like, the strategy won't necessarily bring in net positive on our end. It's too risky, and now it's definitely not the right time. We would also be putting our employees at risk by exposing them in a different area.
What else do you have in mind, Richard?
Okay, so how about this? Maybe we can venture into diversifying our services. Maybe we can invest in better technology and offer teleconsults.
I agree with Richard there for the teleconsults. They're very timely now, and people are encouraged to stay home. Doing that makes healthcare more accessible and mitigates the spread of COVID. We can also offer delivery of prescription medicines to pair with the telecommunications we'll be offering.
Okay, but again, we don't have the money or infrastructure to pursue telemedicine. How exactly are we going to pull it off?
I think it's a really good idea and we should find a way. And I think it's a good investment since everyone's shifting to an online platform like multiple industries. So we should take advantage of that shift and ride that wave. We can easily get the money we'll spend on internet connection back. We just need to properly schedule out each consultation and of course let everyone know that we have online services available. Plus, doctors can use any device as long as it can support the application. Mentioning this to our loyal customers can be a simple way of spreading the word without it being too costly.
It's good because it helps us service our community better and we boost our revenue as well.
Do you have anything else in mind, Richard?
I guess I want to expound a bit more on that. By diversifying our services, we can tap into a new market, one that is relevant amidst this pandemic. Filipinos are actually warming up to the idea of telemedicine and thinking long term. It can even help us solve the seasonality of our income by transcending geographical boundaries.
It's a really good point. Even after the pandemic is over, we can still use the technology that we invested in to our advantage.
Okay, just remember na lang siguro that it's not going to be easy to set this up. Like, we really need to hire developers for our telemedicine system. And it's even going to take longer if we aim to launch an app.
I think, like with any idea, it might take some time, but we can have beta launches to get the ball rolling and improve our systems as we go, since I think it's a really good idea worth looking into.
Does anyone have other ideas or concerns, maybe?
I think we covered it pretty well.
Yeah, I've pretty much said all of my suggestions as well.
Okay, then I guess we can adjourn. So just to recap, we're looking at launching new services, specifically COVID testing and telemedicine. We're also going to push for lowering our prices strategically and cutting back on expenses by arranging alternative setups or temporarily suspending our non-essential employees. So these are the things that could be discussed further for our next meeting. So yeah, thank you guys.
I think you guys had all good ideas.
Hi, guys.